Aloha, everybody. It's time for Aloha Fridays with Dr. Pete here in Hawaii. Now, some of you might think, why is he coming to us at a different time? Because it's not a different time. So the way it works is here in Hawaii and also in Arizona, there might be one or two other states that do not change the time. So for us, it's still 9:30 a.m. So we'll see how that goes with all of you, and if we want to change that any time in the next few months or not. But regardless, it's still 9:30 a.m. here. So that's why, again, it might seem like a different start time for you. Also, in honor of St. Patrick's Day, got just a little bit of green. I'm not a big green guy, but also because of our high population of military families, active duty, veterans, and so on and so forth that we treat, I thought maybe go a little camo green today. Another couple of things too about St. Patrick's Day here in Hawaii. Hawaii is actually Irish. That's right, exactly, because we live on the island of Oahu in Honolulu. I know, crickets. I'm sorry. That's the Dr. Pete dad joke of the day. Anyway, so let's get down to business. Marissa's not with us today because, again, that time changed things, so we're trying to work that out. So I'm live and in charge. Okay, so we have some questions today. Our topic is arthritis. Arthritis, very, very common. Lots of commercials, lots of money spent. Number one cause for all kinds of aches and pains in the United States and North America. So the first and most important thing is to understand that there are different types of arthritises. Okay, there is inflammatory, there's degenerative, also called osteoarthritis, there's autoimmune, like the lupus, like rheumatoid, things like that. So there's a lot of different kinds, but today, specifically for our discussion, since we're talking chiropractic treatment today, not just diagnosis, is osteoarthritis. So that's the wear and tear on the bones and joints, specifically of the body. So first and foremost, okay, so the question is, who gets arthritis? Everybody. Okay, but especially, it doesn't really start in young kids, so this osteoarthritis, it starts later, 20s, 30s, 40s, 50s, and so on. Some people say, old people go to see chiropractors because they have arthritis. I started having arthritis when I was in my teens, maybe early 20s. That's when I saw my first arthritis in my neck on x-ray. And at this point in my life, I've got massive bone spurs in my neck. The discs are almost shot, tons of osteoarthritis, fusions and all that kind of stuff. Yet I have full range of motion, pretty close in all directions. Yet I have terrible x-rays. So we always say we don't treat x-rays, we treat people. So based on my x-rays, I should only be able to move my head about that far. Okay? So that's really important to know. So what happens is with arthritis, it's a gentle, slow wear and tear of the joints. It's not because you had an accident, a slip and fall. It's not because you are old. There's so many different factors. Number one factor of causing arthritis is gravity. We can't get away from that. So we're using our joints against gravity all day, every day from the moment we're born, and they just start to wear down. But again, slips and falls, bad posture, sure. Car accidents, sports injuries, too much time at the desk like this, all lead to osteoarthritis. And so a lot of people then think, that's inflammation. I'll take an anti-inflammatory. Well, that's not correct. That's like saying a cavity is inflammation. So a cavity in the tooth doesn't happen overnight just by eating a piece of candy and not brushing. It takes months, if not years. It's exactly the same with osteoarthritis. It's not an overnight problem. But what happens is the body starts to compensate for it and work harder around it, and then you start to get the aches and pains of the joints, specifically the muscles, tendons, and ligaments around the joints, trying to work harder to stabilize it. Then the body sends in calcium, like a bricklayer sends in mortar, to put bricks together, and the body starts to change the shape of the bones. They become rough or flat or pointed or hooked. And again, because they don't function right, that's what's going to cause the body to work harder, the muscles to work harder, and you're going to be more sore, tender, stiff, and tight. Another thing to know also is that as far as arthritis of the spine, not the bones per se, but the actual discs, has a different name as well. That's called It's called spondylosis, or people come in and say, oh my God, the doctor told me I have degenerative disc disease. Yeah, DDD, it sounds terrible. What that means is as we age, we start to lose water from our discs. That's why we get shorter. That's why Grandpa wears his pants higher. He pulls them up higher instead of getting new pants. And so what happens is we start to lose water in the discs and we start to get a little bit shorter at a time. That's what degenerative disc disease means. It doesn't mean bulging or herniated. It just means it's gotten thinner and smaller. Okay? So anyway, so back to our joints. So again, osteoarthritis, also called degenerative joint disease, is not true inflammation. True, real inflammation is falling down, spraining your ankle, banging your elbow, something like that. Okay, what happens is the muscles around and the ligaments around the joints are working harder all the time. So the body is starting to put down the pain chemicals, the waste products that again touch the nerves, the pain nerves that we've talked about before. So what the traditional way is, okay, I'll take some anti-inflammatories. So what are you doing? Are you stopping the cause of the inflammation? No. You're just blocking the chemicals from reaching your pain receptors so that you don't feel it in the brain. So what we really have more is a congestion, which is the pain chemicals are sitting there in the muscles, and the muscles are exhausted. Imagine going to the gym and working out all day, every day, and how sore you'd be. So that's kind of what happens with osteoarthritis kind of pain. Limited range of motion, muscles working harder, breaking down, getting more fatigued, putting out all the pain chemicals, the lactic acids of the world, and those other ones. All right, so how do we identify it? Well, first of all, there's range of motion and flexibility we look at on the test. We do some orthopedic tests of pushing on the different joints, taking them to their range of motion to see where they're restricted. And of course, there's always x-ray as well, which is a telltale sign of arthritis. Again, just because someone has arthritis on an x-ray, it does not mean that they have any pain. Two different things. So once we diagnose it, what is the treatment chiropractically? Well, first of all, we want to get the muscles to loosen up so we can get the joints moving better. So we use soft tissue work, manual therapy, massage therapy, heat, stretching before the adjustments. Then the chiropractic adjustment or manipulation is going to put just enough movement and force into the joints to get them to move so that they are starting to move properly again. Because again, they've broken down because just like not brushing your teeth, the joints haven't been moving right, so they just get confused, they break down, and they're just trying to compensate. So as chiropractors, we are the mechanics, and we go in and find those joints that aren't moving right, and we get them unstuck and moving in the proper position. Again, it's not like, oh, doc, just unstick my bone and fix it, put it back in place. It's like saying, oh, just unfix my crooked tooth. No, it's like braces. You got to put braces on for 6, 12, 18 months. In chiropractic, we're not talking about that long a time for arthritis. Depends how degenerative it is and how bad it is, but we're just talking about getting motion into the joints, getting the muscles loosened up, getting more range of motion, which will build the endurance and strength of the muscles around it, so you're not going to get as tired, as stiff, and sore as often. So we're trying to find that sweet spot of how long you can go before it starts to feel tight and stiff again. And it's usually 3 weeks is the best, 3 to 4 weeks, because after that time, the arthritis and the degeneration start to kick in again. Okay? What else can I do to prevent it? Well, first of all, don't get it in the first place. Easier said than done, but it's just not a thing. But yeah, not being a couch potato helps. If you don't use it, you lose it. So as long as you're moving around and doing exercise and things like that, that will not only prevent, but it will also slow down the progression of arthritis. The problem is, once you have it, sometimes you can't do those things, and because you can't do those things, it hurts. Because it hurts, you can't do those things, and that creates more arthritis. So that's why people with knee arthritis often can't work out to lose some weight, and because they can't lose weight, it hurts their knees, and they get arthritis. That's where I'm going with it. So as chiropractors, we identify those areas and we help get those joints moving better, get those pain chemicals and inflammation out so you can increase your activity level and start doing some things for yourself. Sure, once in a while you can take an over-the-counter anti-inflammatory drug called an NSAID, non-steroidal anti-inflammatory, the Advil, Aleve, Tylenols, acetaminophen. Again, they have no long-term benefits. They have more side effects than help. But again, sometimes we need help. It's just like having more tools in your toolbox. So, but ultimately, we want to get the joints moving. We want to get you more active, and we want to keep it under control. So we talked before about fixing things, and that's great if you never had it in the first place and you just started it. But once someone's chronic and they've had it for years and years or months and months, then what we do is we manage it and keep it under control, like the example we always use of asthma. So when you come to see a chiropractor, we'll identify those areas, we'll pick the right type of adjustment for you, the right type of heat or stim or ultrasound, the right type of home stretches or exercises. We'll talk to you about how you can do something different at work, posture, or how many computers you have in front of you, or how much time you're on the phone, or how if you put a pillow behind you, just little things like that, how you're sleeping, where you're doing your homework if you're a kid. Maybe wear a helmet if you're riding the bike and you're going to land on your head, which been there, done that. So that is sort of the chiropractic approach to it. That gives you a little insight about what causes osteoarthritis and what can be done about it, and we can still get you much, much better. So give us a call, ask me more questions, and in the future we'll talk about the different types of arthritis in addition to just osteoarthritis. So peace out from here in Hawaii, and remember, how old you are is your business, but at IFC, which is Hawaii's Spinist, how old you feel is our business. See you next Friday. Mahalo.